Welcome back to Talanoa Tupe. We're here with Dr Lupe Taumoepeau. What's the most rewarding part of being a doctor?
There are lots of really rewarding parts. So the things that kind of fill my bucket and give me joy are seeing good outcomes for patients, and that, that's different things for me. So, the thing about surgery is it's a very hands-on specialty. People joke that, surgeons have a short attention span because we do an operation and we can, it's instant in terms of the outcomes. For me, when I'm dealing with blocked blood vessels, I do an operation to restore the blood flow, and I can tell immediately, that the foot looks better. So there's this sort of real instant gratification that you get from surgery. So, every time I have a good outcome, I find that, rewarding. When patients, when I perform an intervention and spend some time educating a patient about how they can reduce their risk going forward, and I can see that they're taking that message on board, and they come back to clinic and they've made small, meaningful lifestyle changes. I think that really gives me satisfaction. But also I get a lot of joy from teaching, and I come across a lot of medical students and junior doctors. I'm involved in teaching and mentoring for them, and so for me, I also find that part of it really rewarding. Seeing a junior doctor on their first day who's really hesitant, not sure about what they want to do, how their year is going to progress, and then, sort of by the end of the year, just seeing how confident they've become in terms of their skills and, and them getting the same sort of fulfillment out of their job. So, I love all of those aspects of being a doctor.
What's the challenging part?
So in the same way that I love my patients and they give me a lot of energy, they can also be challenging. Some of it's forcing myself to, grow in terms of, when I have challenging situations, I really have to examine, what it was that made me uncomfortable about that. Sometimes it's my communication, and so that's a way for me to grow and to learn. Sometimes it's, because I don't have all of the information, so just making sure that I'm really well prepared when I'm having, difficult conversations with patients about, their healthcare, and, some of them are potentially, life-threatening decisions that patients have to make. I also find the system a little bit frustrating and challenging to work in. I think seeing the inequity of patients is something that, I find really confronting and challenging in what I do. And there are, seemingly small things that I think can change in the system, but, trying to affect some of that meaningful change on a bigger level, we often come up against lots of barriers. Just I guess trying to work within those constraints and still feel like I'm making a meaningful difference, that would probably be one of the biggest challenges.
Yeah.